Hi, this is Pat Dillon. This video will depict the sensory examination. So, for the sensory examination, keep in mind whenever you're doing sensory, explain to the patient what you're doing, but also make sure the patient closes their eyes, because if they can see what you're doing, you're giving them the edge. Alright, so, so what I'll be doing is just touching you on your arms and legs, and we'll start with that first. So when we do sensory exam, there's superficial sensations, there's deep sensations, and there's discriminating sensation. So we're going to start with our superficial, which is light touch, pain, and temperature. Now, I will tell you that if pain is intact, you don't need to test temperature. Temperature and pain run along the same track, so you need to test one or the other. With children, probably temperature is the better to test because they don't like being poked at too much. So for light touch, we would use something such as a cotton ball, and for pain, we'll use something like a toothpick. The other thing, keep in mind, when you test, you're going to compare side to side, but you cannot assume if the patient can feel it distally that it would be intact all the way up, because you're testing different dermatomes as you're testing, and so you have to randomly compare side to side when you do superficial sensation. So you're going to let the patient know what the sensations are. So this, close your eyes, this would be soft, this would be sharp. Okay, you good? All right, so tell me if it's soft or sharp.
Sharp. Sharp. Soft. 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 Sharp. Sharp.
So moving down to the legs, we'll do sharp and dull. Soft.
Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Okay, so after we do our light touch and pain, we're going to do our deep sensation, and there are two deep sensation. So there's vibratory sensation, and what you're going to do is take the tuning fork, and I'm going to place it on a knuckle, and you're going to tell me if you feel it and when it stops. If this is intact distally, it's intact all the way up. So all we need to do is a finger on each hand and one toe on each foot. So you ready? Okay, so close your eyes. Feel that? Stop.
Stop.
Whoops.
Stop. Stop. Stop.
Okay, good. All right, so that's your vibratory sensation. The next one is called kinesthetics or position sense. So what I'm going to do is move your finger, and I want you to tell me which direction, up, down, or left or right, okay? And again, if this is intact distally, it's intact all the way up. So close your eyes.
Up. Down. Right. Left.
Okay. I'm going to do the same things on the toes.
Left. Down. Up. Down.
Okay, good. Okay, so after we do our deep sensations, we're going to do some discriminating sensations. So what you're going to do is you're going to test stereognosis. So what I'm going to do is put something in your hand. I want you to close your eyes, and I want you to tell me what it is. Give me your hand.
It's a coin.
Correct. Okay, good. And your other hand?
Wrinkly.
Correct. Okay. The other discriminating sensation we're going to check for is called graphesthesia. And the way I remember this, graphic means to write. So you're going to write a number or a letter in the patient's hand and have them identify it. Again, close your hand, let them know what you're doing. So I'm going to do a number, okay?
8.
Okay, good. And how about I do a letter?
A.
Correct. And that's referred to as graphesthesia. Now, another discriminating one is referred to as point localization. So what I'm going to do is touch you, and I want you to close your eyes, and I want you to point where I touch. Okay, good. And then there is another one called extinction, and this is the patient's ability to determine if you're touching them in simultaneous spots. This is a good test for stroke patients because oftentimes on their affected side they're not able to do this. So I'm going to touch you, and I want you to point to where I touch you. Okay, great. There's one more that we're going to talk about, and that's referred to as two-point discrimination, and that's the patient's ability to determine if you're touching them with 1 point or 2 points. And their ability to discriminate this will depend on the area that you're testing. So we'll do the forearms, and then I'll show you the difference when we move down to the hands, because your fingertips are the most sensitive and most discriminating. So tell me if you feel 1 or 2.
1.
Right. Usually I try to start where they feel 2.
Not 2. 2. 1.
Okay, good. So it was about a centimeter and a half distance between his ability to discern it as 2. So that would be normal in this area, but now watch as I move down.
2. 2. 1.
Okay, again, see how much closer it is? Now if we move to the fingers,
2.
sorry.
2. 2. 1.
And see the difference? And again, this is what you'd expect because this is the most discriminating part of your body. And that concludes the sensory exam.